Welcome, my friend. I'm Rick Johnston. I'm at WHO, where I co-lead the WHO UNICEF Joint Monitoring Program, which is joint with UNICEF. And the Joint Monitoring Program puts out reports on the status of WASH in households and in schools and in healthcare facilities. We're now in a regular cycle where in even years, we put out a report on schools and on healthcare facilities, and then in odd years, we turn our attention to WASH in households. And this year, being an odd year, we have put out our report on WASH in households with a special focus on inequalities, which I'm going to be sharing results from today. We're going to have about half of the session will be presentation, and then the other half will be group work, where we want to hear from you, especially about the data that the JMP produces, how you are able to use it, if you're able to use it, what you would like to be different or better to make it more accessible or useful to you. So bear that in mind as we go through the presentation. We're not going to have a plenary question and answer session, but there is an online Q&A tool and a chat box. We also have participants online. I welcome you all, even though you can't unmute your microphones and make comments. But please do write your specific questions in the chat or the Q&A, and then during the group work, I'll try to respond to those. And also, following the conference, I know that the recording will be made available. So, let's see. The JMP has been around since 1990, so this year we celebrate our 35th birthday. And yay, happy birthday. So we put out a report, and we also refreshed our website. We've had our website since the SEG period, and it was getting a little bit creaky. So I hope people can take a chance to go to washdata.org and see some of the new features. We've tried to make, again, data more accessible and a little bit more intuitive to get around. There's also a QR code there if you want to not type washdata.org. And throughout the presentation, I'll be showing you some of the things you can do on the website. So, into our report with a special focus on inequalities. The title of the session is 5 Years to Go, and that's, of course, the SDG timeline. And I think we can just call it right here today. We're not going to meet the global SDG targets for safely managed sanitation, safely managed drinking water, and universal basic hygiene for all. There has been notable progress, but the rate of progress would need to be much higher in order to get to universal by 2030. It would need to be 8 times higher for safely managed drinking water, 6 times higher for safely managed sanitation, and double for basic hygiene. Even if we look at basic drinking water and basic sanitation, we would need to see rates at about double the historical rates. So that's the kind of glass half empty side of the story. There is a glass half full side of the story too, but these kinds of projection figures in our reports are increasingly not useful, because with the short amount of time ready to go before 2030, it's clear that we're not going to make those universal targets. So one thing we want to do in this report is shift the focus a little bit more to rates of progress and look at the historical rates of progress, which you can also disaggregate to different groups. So if we look, for instance, at basic drinking water on the left, we see that the progress has been about 0.5 percentage points per year. In order to get to universal, you would need to be showing 4.2 percentage points per year, 8 times higher, which is not going to happen. But if you break it up into different groups, you can see that actually the low-income countries, the fragile contexts, face much greater challenges, partly because their baseline levels are lower, so there's further to go. But in some cases, the rates of progress are slower in those fragile contexts, for instance. In some cases, they're higher, so there's an interesting breakdown of rates of progress. If we look at a few of the other global indicators, the good news story, I guess, is elimination of open defecation, where we would need to see 0.6 percentage points per year to get to 0 by 2030. And historically, we've seen 0.7%. So globally, we're on track to eliminate open defecation by 2030. averages conceal disparities, and if you look at the low-income countries in the fragile context, you can see that the dark bar is bigger than the light bar, which means that we would still need to see acceleration in those areas, but it's not insane levels of acceleration. You know, in fragile contexts, it might need to be 2-3 times higher, not 8-10 times higher. And we have seen settings where 1-2 percentage points per year is achievable given political will. So I think the open defecation story is one that might have some positive elements. So that's about proportions of populations, but you get an important and different story if you look at the number of people affected. So these figures show that even in the face of tremendous population growth, the population lacking safely managed drinking water, safely managed sanitation, basic hygiene, has reduced over time. So the population without safely managed drinking water has gone down from 2.4 billion in 2015 to 2.1 billion last year, 2014. Look at hygiene. It's gone down from 2.5 billion to just 1.7 billion lacking basic hygiene. Tremendous progress there. But if you break that up into the rural and urban populations, you see a different story. You see that most of that progress has been in rural areas. And that could mean that services are getting better in rural areas, but it can also mean that people are shifting from rural areas to urban areas, where then it's harder to see proportional progress because of the greater strains on services in urban settings. In fact, if you look at the population lacking safely managed drinking water, that's actually gone up in urban areas between 2015 by almost 100 million population. On the right side, you see a similar analysis by type of country, by World Bank income group. And here you can see that in the low-income countries, the population lacking access to all three indicators has actually increased since 2015. A lot of these countries are facing rapid urbanization, but also rapid population growth, and are not keeping up with those challenges. So the report has a special focus on inequalities. We focus on different types of inequalities. There are lots of examples of urban-rural differences we've been talking about. That's relatively easy to disaggregate. But there's a nice example of Lao PDR going further and breaking up rural areas into rural areas that are close to roads and far from roads, all-season roads. And you can see, I mean, you can't see on this graph, but if you look in the report, you'll see that services are lower in rural areas without access to roads, but those gaps have been decreasing over time because in Lao PDR, they've been doing this for multiple cycles. It's a little bit harder to get at socioeconomic characteristics like education level, ethnicity, race, religion, language. Sometimes you can just add a stratifier to a household survey that's targeting an entire population. But sometimes for smaller populations, you need dedicated data collection methods. And Paraguay is a nice example where they have a regular census that has some WASH questions, and then they have a specific census for indigenous populations. And you can compare them and see that there are some gaps in service between the general population and the indigenous groups. And maybe the hardest is to stratify by individual characteristics like sex or age or disability, because so much of the data that we have is collected at the household or larger scale. One nice example is household surveys on menstrual health, because that is collected at the level of the individual, so we can link that with other information about the socioeconomic characteristics of that person and see some interesting disparities. And inequalities are not independent of each other. They often overlap. So we worked with the team that's developing the WASH insecurity analysis at the WASH cluster led by UNICEF, or WIA, which integrates WASH with other current and future hazards as well as vulnerability to find out at a subnational level which areas are facing the most insecurity so they could be targeted for priority mitigation efforts. And you can see here that inequality or WASH insecurity is not equally distributed in Kenya. You see much more in the north and the east of the country, which not surprisingly is also where much of the cholera has been found in that country. And in fact, we worked with the WASH cluster team and the Global Task Force for Cholera Control to show that the countries facing the biggest burden of cholera over historical, the last 10, 15 years, those are countries that are facing low water and sanitation, basic water less than 75%, basic sanitation less than 60%. That accounts for 97%. Those countries account for 97% of the cases of cholera. And of course, within those countries, cholera and inadequate wash are not equally spread. So there's a lot of efficiency to be gained by identifying the most vulnerable populations and targeting them. Okay, let me dive into the different chapters of our report. We have standard chapters on water, sanitation, hygiene, and menstrual health. And we'll start with water. I think people are familiar with the service ladders that you really need to unpack to follow the global monitoring, to follow the JMP reports. We use these service ladders to benchmark and compare progress across countries. So with the drinking water service ladder, we have 5 levels ranging from no service, using surface water, all the way up to safely managed drinking water services, where the water that people are using is improved, but it's also accessible on premises, it's available when needed, and it's free from priority chemical and fecal contamination. The top 3 rungs are all people using improved drinking water supplies, the MDG indicator, and then the top 2 rungs are basic or safely managed. We sometimes call it at least basic. And that's an SDG indicator as well. It contributes to goal 1 on poverty, target 1.4. In our chart, we have these Tetris charts that look at populations, and we also show the proportions on the side. We talked about the different messages you can get from proportions and populations. And here you can see that in 2000, well, first you can see that between 2000 and 2024, huge population growth in urban areas and very modest population growth in rural areas. But you can see also that the number of people with safely managed drinking water has increased in both urban and rural areas, the dark blue. If you look just at the proportions, you would say urban areas, 83% safely managed in 2000 and 83% in 2024. Stagnation. Nothing's happening in urban. But if you look at the population, you see that about, 1.5 billion people have gained access to safely managed drinking water in urban areas. So that's about 3 out of 5 people gaining access living in urban areas. By contrast, in rural areas, the population is pretty flat, but the coverage has increased by half, from 42% to 60% of safely managed drinking water. You can also see here a big decrease in the population with unimproved water or no services, population drinking surface water dropping from 232 million in rural areas in 2000 down to just 95 million, and only 9 million in urban areas. So big progress also in eliminating or reducing the lowest levels of service. Now, I want to break from the report and talk a little bit about our website, washdata.org. We've tried to make it easier to access the different features on the website. So I want to just show you the interactive data portal first. You can get to that by just clicking on households. We also have similar portals for schools and healthcare facilities. But that would take you to this landing page where you see some sample graphs that you can edit, or you can create your own new chart. And if you select Create Chart, there's 5 different types of charts. I like ladder charts. They're very straightforward. We talked about ladders. We like ladders. And if you click on ladders, you get the default, the basic water, sanitation, and hygiene ladders for the world. And you can edit this. So you can click those boxes. You say, I want to look at rural and urban separately. I want to focus on drinking water. I want to compare 2000 to 2024. And you select those things, and you get something very much like figure 23 in the JMP report. It's not as pretty, but the numbers are there. And you can share that with someone if you want. You can download those data. Let's see, there's an animation here. There we go. You can save it as a dashboard and email that to someone and then say, look, I saw this big change happening in urban areas, whatever. So we hope people can use that tool to make their own analyses and tables and share those. Coming back to the report, our last report had a special focus on gender, and this one also has some charts showing gender inequalities, especially in water collection. So here you see a chart on the left. Hello, where I think I'm in the wrong area. Yes. This is showing water carriage burden with women and girls on the right and men and boys on the left. And the biggest dot on the outside is just who has responsibility for collecting water in the household. And you see a lot more on the right-hand side, women and girls, than on the left-hand side. You do see a few cases where, Mongolia, Turks and Caicos, where there's a big bar to the left, men have the responsibility for collecting water in those countries. You'll also see the smaller icons are, well, what proportion of households are spending more than 30 minutes, more than 60 minutes, more than 120 minutes collecting water? And that's where you see the heavy burden is borne by women. And there are basically no cases of men spending large amounts of time collecting water, even if they are the primary person responsible for collecting water. You can visualize this in another way by just looking at the proportion of households where women or men spend more than 30 minutes per day collecting water, and guess what? It's almost always women, especially the extreme cases. If you look at Kiribati, you can see more men collect water than women, but very few households need to spend more than 30 minutes collecting water in this Pacific Island country. Way down at the bottom, if we look at Malawi, though, we can see that in about half of households, women are spending at least 30 minutes collecting water. In basically, no households are men spending more than 30 minutes collecting water. Even a third of households, roughly, women and girls are spending more than 60 minutes a day. In about 1 in 6 households, it's more than 2 hours per day collecting water. So we think these kinds of new metrics about the water burden can highlight some of these inequalities. This report also shows inequalities in safely managed drinking water services. So for the past 10, 15 years, the JMP has been working with household survey programs to integrate water quality testing into household surveys. And that allows a single survey to collect all the information you need on improved water that's available on premise, available when needed, accessible on premises, and free from contamination to get to safely managed at the household level. And what you can see in Bangladesh is that almost all districts, there are 64 districts in all, but I think 2 of them, most people, more than 70%, have access to improved water. In all of the districts, most people, more than 70%, have access to water on premises. The one on the, that is available when needed. Quantitative sufficiency of water was not a problem in this survey. Accessible on premises, in the top right, you see that there are a number of districts in the south, in the east, in the hilly parts, where people don't have water on premises. And that's because in the coastal zones, you have salinity, people need to go to communal water sources, or the hill tracts have a different geography, and there's a lot more sharing. Water quality on the bottom, there are 4 districts where more than half of the population had arsenic in their water, above the WHO guideline of 10 parts per billion, and about half of districts, I think more, no, not quite half, 20 districts where half of water supplies were contaminated with E. coli at the point of collection. So different geographic spreads for all of these, and when you combine them together, you can see that very few of the districts, I think it's 44 out of the 64 districts, less than half of the population has safely managed drinking water at the household level. But it's different factors. Often it's water quality that's the most limiting factor, but different factors apply in different parts of the country. Okay, I want to move on and pick up the pace a little bit to sanitation. We have a similar service ladder in sanitation going from open defecation to safely managed at the top, where to count as safely managed, the household should use an improved sanitation facility, but one that's also not shared. That gets you to the basic level, but also with some management of the feces. It could either be safely managed in situ or emptied and removed off-site for treatment. But there needs to be some kind of management of the feces to count as safely managed. Again, the Tetris graph here shows that big progress. Between 2000 and 2024, the number of people with safely managed sanitation has doubled. It went from 1.9 billion in 2000 to 4.8 billion in 2024. That's an increase of 2.8 billion people. And that translates to more than 100 million people every year gaining safely managed sanitation services. That's like if you took the entire population of Egypt and gave them all, or they all achieved safely managed sanitation every year for 24 years. So there's big success, even though we're not going to get to universal by 2030. And again, most of that gain, about 60%, has been in urban areas. We've seen that this is partly due to urbanization, but in sanitation, progress is not just keeping up with urbanization, it's increasing. So if we look at the urban setting, going from 48% safely managed as a proportion to 66% in 2024. So we do see capacities increasing, more wastewater treatment going in basically in urban settings. We also can see a tremendous reduction in open defecation, which dropped by nearly 3/4 from 1.3 billion to 354 million. So that's almost a billion people fewer, 943 million people fewer practicing open defecation in 2024 compared to in 2000 in the face of population growth. And more than 90% of that is happening in rural areas. In fact, in urban areas, less than 1% of the global population practiced open defecation in 2024. If we look at different regions of the world, one region stands out for reducing open defecation. That's Central and Southern Asia, where the number of open defecators went down from 864 million in 2000 to just 129 million people in 2024. So that's an 85% reduction. Most of that is driven by the big country in the region. India contributed about 70% of that drop. 676 million people fewer in India practice open defecation today or last year than in 2000. In sub-Saharan Africa, that's the second series, you also see a decline, the proportion's declining, but the size of the bubbles isn't decreasing very much. That's because we see big population growth in sub-Saharan Africa so that the number of open defecators is only reduced by about 10 million people over that time period. There's a teeny dot you can't really see very well, that's Oceania, that's pretty much flat, and we're just seeing not much progress in addressing open defecation in those Pacific Island countries. We're getting more and better data on safely managed sanitation, which you can get through having sewers that connect to treatment plants that provide a certain level of service, secondary treatment or better. That's how most people who have safely managed sanitation get it. But more people globally use non-sewered sanitation than use sewered sanitation, and that can also be safely managed. But we face big data gaps around safely managed sanitation. In low-income countries and high-income countries, there are not standard data systems about how well are these pits and tanks actually containing the waste. What happens when they fill up? Do they get emptied? Where does that stuff get taken to? What happens when it's there? It's a complicated story. And for that reason, it's hard to find data about that whole sanitation service chain. We've had a project supported by the Gates Foundation to look at the safe management of on-site sanitation, or SMOS, that's been running for the past 4 or 5 years. We have a training package that's available with this QR code. And one of the emerging indicators that's come out from that is around containment, because I think a lot of the focus in the sector on non-sewered sanitation has been on fecal sludge management and getting those emptying services and getting the treatment plants, and that's all super important. But a lot of those tanks and pits are leaking waste into the environment. So even if you have a great FSM chain, if that septic tank is discharging raw sewage into an open drain the whole time, it's not safely managed. So in some of these countries you can see here, they're starting to collect data through the mix and other surveys on, well, that pit or that tank, has it released excreta to the environment over the last year because it collapsed, or it flooded, or it overflowed? Or in Bangladesh, there was a different question: can water get into that on-site containment? And any of those indicate that the pit, the tank, is not adequately separating excreta from the environment. It shouldn't count as safely managed in that case. And you can see in Mongolia, there's fairly low levels of leakage or non-containment. In Somalia, it's 20, it's 30, it's even 50% of these on-site systems are leaking waste into the environment. So Somalia, let's look at Somalia. If you go to our website and you type in Somalia, you'll get a new country landing page. It's a new feature on the website. And if you click on Somalia, you'll see, well, we can go to the interactive data portal for households or schools or healthcare facilities, or we can just download the Excel files that have more detailed information. So let's look at those Excel files. There are Excel files for the country, household files, inequalities files for schools and healthcare facilities. And if we just look at the country file for Somalia, we get an introduction page like this. These files are now multilingual, so if you prefer to read in Arabic or in French or Russian, you have that choice. We're going to stick with English today and see that in Somalia, there were, we could do it. On pourrait le faire en français si vous voulez, comme vous voulez. We see that we have about 12 or 13 national sources of data that are used to produce the JMP estimates. And for each of them, you can look in the details. So on the very right-hand side, you can see the 2024 national, I can't even read what it is, but it's the national assessment about sanitation, wash in Somalia. That's the source for this containment data. You can see how many people report using sewers or septic tanks, not very many in Somalia. You can also see the containment, the emptying. If it is emptied, is it buried on site or is it taken off site? Not very many of them are taken off site in Somalia. But if you're interested in the where these data come from, the country files are the place for you to go. If you scroll down, you can see the specific types of sanitation facilities that people report using. Again, in Somalia, it's mostly pit latrines. You can also see how one survey compares to another, and they're not all surveys. We have data from national authorities, from regulators, and we put them all into the linear regression that we use to produce estimates. So a great resource, if you're really interested in a specific country, is to download the country file and see what data have been collected to produce the estimates. Let's shift to hygiene. So happy to have hygiene as part of the SDG framework. And we have a simpler service ladder for hygiene, just 3 levels. There's no safely managed hygiene yet. And the basic hygiene service level, which is the SDG indicator, is simply defined as the availability of a hand washing facility with soap and water at home. If you have a hand washing facility but you're lacking soap or lacking water, that counts as a limited service level. And if there's no hand washing facility, well, then that's no service. Now, water and sanitation data might come from a ministry, it might come from a utility, it might come from a regulator. There tend to not be, government authorities maintaining databases on hand washing facilities and soap and water in the home. So pretty much household surveys are the only source of data we have for this indicator, which means that we have data for countries that field household surveys, and we don't have data from high-income countries where they don't do household surveys, or if they do, they assume that everyone has water and soap in the house and hand washing, so they don't bother asking the water and sanitation questions. So we have data from 91 countries, but big gaps around the upper middle income and high income countries. If we look at the Tetris chart here, we can't go back to 2000 because this is a relatively newer indicator. It started in about 2015. But we can see that there's been progress in both rural and urban areas. Both of them have increased the population with basic hygiene by about 700, 800 million people. So it's nice to see that's a quite high rate of progress. And if you look at the proportions, going from 52% in rural areas to 71% in just under 10 years, that's pretty impressive. The other thing that's interesting about this graph is if you look at the rural population between 2015 and 2024, it's actually declined. There are fewer people living in rural populations. We've reached peak rural population. I think it was in about 2012 or so. One thing we're trying to do more and more is to look at subnational distribution of the WASH indicators. It's really useful for national planning purposes, and inequalities are not equally spread throughout countries. So a household survey will often collect data at the district level or the region level. They're often not powered statistically to collect very local scale, but maybe 8, 10, 20 regions in a country can be statistically representative. So we've worked hard with the UNICEF team to use machine learning techniques to match the names of these regions in a household survey to shapefiles and polygons so that we could map them geospatially. It's a lot harder than it sounds. It sounds pretty easy. You can see immediately, though, within a country there are some big subnational disparities. If we look at India, you see the eastern bits of India having much less access to basic hygiene. If you look at Nepal, it's higher, but there are two districts where you're below 75%. They're in light purple. And we want to make these more available. So remember our downloads page. And by the way, the downloads page also has a world file where you can get the basic WASH indicators for all countries in the world in one place. Save yourself some time. But the inequalities files, I want to show you what those look like. We're in the process of updating those. The last set came out in 2023. But the inequalities files have a lot more stratification and a lot more variables than the country files. And they're only available for pretty well standardized household surveys, so mostly the mix and DHS surveys, but there are a few other examples. And if we would look at the 2019 mix in Nepal, we would see that we can get a lot of indicators stratified by urban and rural, but also by wealth quintile. We create our own wealth quintiles based on assets. You can see for, say, at the national level, there's a pretty high coverage of basic water services, so you don't see a big inequalities. But if we turn to hygiene, you can click these tabs to move around. Look at the wealth quintiles there. The poorest having much less access to basic hygiene than the richest. It's normal. We see that in every country, but it's also very powerful to have these data, and again, for lots of different indicators. And if you click further to the right, you can see that subnational spread. You can see this survey had 8 provinces, and in 2 of them, it looks like Karnali and Sudur Paschim provinces, hand washing is a bit lower. So those are the 2 that you saw on the map in the report. But if you're really interested in details, the inequalities file is a place where you can go. And in fact, if you're a data hound, there's a data summary tab where it's in a flat format, and you can just read this all into your preferred software and make your own analyses rather than having to cut and paste a lot from the different tabs. So go for it, data geeks. Back to the report, in hygiene, we introduced a new indicator in this report. It's about the availability of bathing facilities on premises with water. Hand hygiene is the SEG indicator for hygiene. And bathing premises, we're not trying to integrate that into some kind of overall household hygiene metric, but it tells a different story. And we find that in many households that have water and soap for hand washing, they might not have a bathing facility on premise. Now, this is a new indicator, so we don't have it for many countries. But if you look at Mongolia, where, by the way, almost everyone has basic hand hygiene facilities at the home, you see huge inequalities. Look at the difference between urban areas, half of population having bathing facilities on premises with water, only 4% in rural areas. So the type of city, the regions, the provinces, big gaps, education level, 70% to 7%. having basic bathing facilities on premises. But oh my gosh, if you look at wealth quintiles, basically all of, not just the top 20%, all of the top 40% of the population have a private place for bathing on premises, and pretty much none of the bottom 40% do. Now, Mongolia is a very special case. They have a large rural population. They have nomadic peoples. They live in yurts or gurs, and you're not going to have, a shower in your gur or a fixed bathing facility. But it's also a very cold country, and you can imagine, a real limit to hygiene being, not having a bathing facility on premises with water during the winter. So we're excited about this new indicator. Did I skip one? No. Okay. As in our last few reports, we've been compiling data on menstrual health and highlighting them. There's been a lot of progress in development of indicators around menstrual health. And in this report, we've updated the indicators that we're using. We've been working also with the UNICEF mix team so that a set of new indicators are now standard in a module that countries can apply if they're doing a mixed survey. So for the past couple reports, we've had indicators on knowledge, on materials, what type of materials women and girls are using, facilities, if they have a private place to wash and change, and participation impacts. We've kept those four, but made some refinements to the indicators to make them a little bit more robust and easier to measure. For instance, the participation one in the mixed 6 round was grouped. Like, were you able to participate in work, school, and social activities? And you don't know which one it was. So we refined it into, have you had trouble participating in work or social activities or education activities, and get more of a granular picture about what the actual experiences are. So some of these new indicators then we've added are around discomfort, the ability to reduce menstruation-related pain when needed, and a supportive environment. Are people comfortable seeking help from a medical provider, from a healthcare provider, if they need to? And those are just newly added, so we don't have many data examples of those. But we do see more and more countries having some data on menstrual health. We're up to 70 countries now. And actually, we have enough data now, including some countries where we have multiple data points over time, to move from reporting the situation in a survey at a point in time to using our standard JMP regression to produce estimates over multiple years. Now, the trends, I wouldn't spend a lot of time on trends because most countries don't have multiple reliable sources of data, but that means that we're able to produce estimates for specific years instead of saying, well, in Somalia in 2018 it was this, and in Burkina Faso in 2019 it was this. Again, inequalities, I think I mentioned at the beginning that this is one of the few sets of data that's collected at the individual level, so we can see a lot more inequalities by individual characteristics like age or disability status or education status. Mongolia is one of the first countries to implement these questions. We see, if we look at the question about awareness of menstruation at first menarche, it's a really important indicator, and a lot of girls don't know what's happening when they have their first period, and it can be very traumatic. We see a big range here. In Italy, 90% of girls reported they had at least some knowledge, maybe not full knowledge, but they kind of knew what was happening. But it was more like a third in Bangladesh, about 2/3 in Mongolia, with not much of an urban-rural difference, but an interesting age difference where the younger respondents were more aware than the older respondents. So that could reflect a change in education and awareness. It could also be related to recall bias. It's hard if you're 48 to remember when I had my first period, did I know what was going on? So I think we'll need to see more countries with this type of data to understand what those disaggregations mean. And also this module, it's only asked of respondents aged 15 to 49, so we have a big data gap around the under 15 age group where people are likely to have their first menstruation. But that's a limitation we have of the mixed surveys. and interesting inequalities that you would expect between richest and poorest, a little bit around disability with functional disabilities and regional inequalities. The last data product I wanted to show to you, because I'm about to wrap up, is that we have what we call regional snapshots available on our website for household, schools, and healthcare facilities. You can get them for all countries in the world, or maybe you're interested in a particular region. And we have lots of different regions. And we automatically produce these Excel files for the SDG regions, or UNICEF and WHO regions, or the income groupings, other regional groupings. We can also make a custom set, like so if you have a region you're interested in, call us. But let's take a look at the Sub-Saharan Africa country or regional snapshot. You open it and you get all of these tabs. I think there's more than 50 tabs, and each tab has a graph or 2 or 3 graphs that we have found to be useful and we produce automatically. So we obviously can't go through those all, but I'm just showing you one. Tab S4 on sanitation shows all of the countries in that region ranked by their level of sanitation. Countries that have estimates for safely managed sanitation on the left, those that don't yet have estimates for that on the right. So if your focus area is at a regional level, I think these can be a powerful way to get some statistics to help your work. And because it's in Excel, you can access all the data. You can change the shape or the fonts or whatever you want. You can make your own graphs with it. Okay, I've been talking a lot. I want to stop talking and give the floor over to you. I've tried to show highlights of the new report. I've also tried to show how you can access JMP data. So maybe one traditional way is you can download our report. I wanted to have print copies with me today. I'm sorry we didn't get them done in time. We're a couple months later than normal in this report. But a lot of people go to the report, they look at the figures. There's about 100 figures in the report. They're quite thick reports. And a big chunk of the report is the back tables, where you can see the numbers for all the countries and for all the regions. So that's one way to get the data. But the other way is to make use of our website. You've seen the interactive data portal. You've seen we have a number of different Excel files. There's the world file, country files, inequalities files. It can be confusing. There's a lot of different Excel files. There's a lot of different countries. So what I would like to hear from you is we're going to break up into 3 breakout groups. And each group, I'd like you to talk about how you do or could make use of JMP data in your work. How do you find it useful? How do you access the data if you are using it? And second, what would you like to be different or better about the JMP data? Could it be easier for you to access in a different format? Are there different indicators or stratifiers that you would be able to use if they were more available? What about our reports? Are there some different analyses you would like to see in those reports? We have long reports. Maybe they shouldn't be so long. Maybe we should just focus on the data and get the numbers out on the website and not produce 100 figures and a report that's 150 pages long. Maybe no one reads that. I don't know. I would like to know. And finally, for the website, is there anything we can do to make that easier to access? Are there different data visualizations or ways to access the data that you would like? So we have 3 groups. I'm going to suggest that group 1 come over here, and Laura Brunson is going to coordinate this group. Group 2, where is Tanvir? Tanvir, maybe if you could move over here and be in the desk area. And then a 3rd group in the back. Bethany, if I could ask you to move back there. And so we have Laura, Bethany, and Tanvir who will coordinate the group work. I will circulate. I will also see if there are any questions online. And then maybe after about, we'll see how conversation goes, but maybe after about 25 minutes, we can ask the 3 of them to report back. So Laura is with Water for People, so it might be more of a NGO advocacy type audience here. Bethany, academic research. Tanvir, also academic research, but close with government, so maybe more if you're interested in working with government or do work with government, Tanvir is your guy. So with that, please discuss.
what they're considering, how successful it has been. It's something that we don't have a lot of information about. Perhaps we never did. So I think that's an unmet need. I'm not sure where it fits into the whole strategy of creating better access to safe work. We certainly know from field studies, epidemiological studies included, that if you provide a credible technique to treat water at home, perfectly better systems that provide increased improvement, the highest level of improvement in terms of water. You can significantly reduce household and community waste. So this to me seems still important. And some of you may know that WHO is sort of taking a bit of a step back in managing this activity within WHO. And therefore, there's a need for others who are interested in this to step up and maybe help strategize and implement the future of
where we were last year and where we are now and where we want to go. Like benchmarking should be improved, and countries like lower middle income countries, they have connectivity, so there should be a offline data as well for them out there. Second one thing was benchmarking. The third one is huge Excel data and should be converted into Power BI and other tools so that people can have some visualization capabilities. In
Let's wrap up in about 2 minutes and come back up for plenary.
I know I missed the whole section here, so as many of our committees, but how easy is it to add indicators? And I'm asking in the context of hygiene and thinking about animal hygiene indicators, as well as when we talk about basic water and sanitation in our homes, whether that is an anthropocentric measure versus something that's also kind of influencing analytics.
Yeah. No, I think it's a great question. I think it's possible to add new indicators if there's clear data stream to populate the indicators, and if it's clearly relevant to public health or programming. So if there's kind of a use that's possible for data. And animal health, I mean, the household surveys, ask questions about presence of animals in the household. I'm sure the questions aren't exactly the way you would want to have them, but there's something there around animals in the house that I think could be promising. Okay, maybe we could start moving back. Okay, well, I got to circulate a little bit, and it seemed like each of the groups was having a good, solid discussion. And what I'd like to do is to ask our three anchors, our three volunteers, to share some of the key topics that came up, key suggestions that came up. And, I'm really interested to hear what the JMP could do better. So I think maybe I want to start, maybe Bethany, could you kick off? Let me just, come on up.
Sure. Yeah, we had a great conversation. Just one thing that to sort of highlight in the back in terms of, do you use it? There are lots of different uses behind, people writing research papers, people writing advocacy documents, people just actually using the documents that already exist, the various pullouts that are created on topic, on region for advocacy for programs, people looking in the reports and in the data to identify where they should work, justify where they should work, present that information to donors as to why they're working in a certain area. And underlying all of this, people kept saying, because it's a trusted resource, so that's why it becomes the first thing in an intro on a paper, the first thing that people are talking to for bringing to donors and things like that. Data visualization was also talked about. There was one suggestion to have a small RIC at your shoulder so that you could get instruction on how to use the data. And while that might not be possible, we did actually talk about, well, maybe there are training opportunities that could be on the website of, little videos like this is how you might use the data, this data resource, this is how you might create this visual, which would be good for students, but it would also be, really useful for those people who are really excited about the data, but then open it up, get a little freaked out, and then close it. Because there's a lot of interest, I think, in general. And then I think maybe for the sake of time, one of the other things we started to, interest in methods, so potentially organizing some of those amazing resources by categories. Maybe there's a page where all the JMP reports are from the beginning of time, that you can find all of them. All the methods sort of things, all the pullouts or the handouts. And then at the very end, we were talking about the ability potentially for layering of all the WASH. Could we have not only like the sanitation information and the water information, but is there kind of like your Kenya example, the WASH insecurity of seeing like, you know, where all that is. And then actually one more thing, which is a lot of interest in the maps. And so is there a possibility to, are there shape files?
The
Also.
maps?
Yeah. I don't know if they're part of the Excel or the data pages to download for people to use, but that was something that people had a lot of interest in, not only to be able to do disaggregated analysis, but then to make their own advocacy documents and justify where they're working. Yeah, lots of great ideas. I don't know if there's anything more that people.
Yeah, maybe I'll just react to that. I think about the subnational, I'm just surprised that there's not a global repository of subnational shapefiles. You know, and that's shouldn't be the JMP's responsibility to do that. And to be fair, UNICEF is working on this in a broader sense, and we're partnering with their geospatial team to make these maps. But it's a hard slog. So I think the demand is there, and we will see more of it. And I'll ask the UNICEF team if those shapefiles can be publicly available, so people could either download them and use them in their own GIS, or maybe there's some kind of platform where you can upload your geotag data and the platform produces the map for you. That might be easier in some ways than sharing the GIS shapefiles with the projections and all that. But that's a great idea. The layering on the WASH, we've experimented with this a little bit. We can do it at the level of an individual household survey for the basic service levels. So in those inequalities files, you'll see basic water, basic sanitation, basic hygiene, and also basic WASH, which is all three of those combined. And then that's stratified by wealth quintiles and subnational area. So that's the one place you can find it now. We've had a couple graphs on that in some of our reports, but we haven't done much with it because it's limited to a single survey instead of estimates. And then, yeah, I think having a video repository, we do have a YouTube channel, but like we don't make much use of it. We don't tell anyone about it. We don't update it very much. So we could definitely do more there in the dissemination and including about the methods, because we have had webinars just on the methods, you know, and we dig deep into the country files and the JMP regression rules and how we produce regional aggregates, and it gets very tech, but there's a certain market for that, and I think having a channel or a dedicated repository for that would be something that we could totally do. Maybe can I invite Laura to come up next?
Notes for you, Rick, so you can have them all afterwards. So I was mostly the NGO group, but a couple of others from academia and other areas. Really great discussion. So a lot of uses of the data. I kind of lumped them into categories to report out. So a lot of use of JMP for proposals and program planning and development. A lot of use for advocacy, so sharing data with government or with other stakeholders and using it in different ways to encourage planning, budgeting, what comes next. Comparisons across time or comparisons across geographies, so comparing a country to a region or different countries to each other, or a specific country or location over time were big ways that the data was used. And then there was an interesting diversity in the group or within the organizations that the group was representing about those who read the entire report almost from cover to cover, which one of my colleagues did and was very excited about what came out of it, versus those who go to the table of contents or to those tables in the back and look for very specific things based on where they're working or what they're trying to do with the data. And then there was a note about sometimes using the JMP data can be helpful to build government capacity, perhaps around priorities or around monitoring and surveying, or using data for planning and budgeting, but that perhaps more support could be helpful for how to do that in different ways. And then moving on to some of the things that were identified that would be useful, we had a nice conversation about how, you know, in this room, we're all like, ooh, JMP, we know about it, we read it, we use it all the time, we talk about it a lot. But outside of our little bubble, in a conference like this, people have no idea what we're talking about or the value that the JMP data has to offer or the different ways in which it can be used. And so are there some ways to make that more accessible, to help people understand, you know, in other sectors like maybe agriculture or nutrition or health, how can this data be used more broadly and in different ways with different groups? As part of that, it was indicated that maybe more summaries specifically that might be useful for governments versus summaries that might be useful for a nonprofit board to help board members understand why we're talking about this and the value that it adds or what it means. And in some cases, more simplified visualizations that could be useful for diverse sectors. And there was some interest in, could the data be more easily transferred to other visualization or analysis options like Power BI? And then on the website, we didn't come up with the idea of having a little Rick on our shoulder to help us, but we did identify that there are things that people are looking for, like different surveys or different instructional documents or different reports that do actually exist on the website, but folks aren't really familiar of where to find them. And so some more help just for those of us who use this kind of data and information could be useful. So I have a longer list for you, but I'll stop there. Unless anybody wants to add anything really critical that I missed.
Well, Laura, let me push you on that last one. I mean, there is a lot of stuff already on the website that people don't know about. So is the suggestion that we advertise more how to find different tools and resources beyond just the estimates, but like the methods, the tools that are available?
Yeah, I think that was my understanding from the group, is that people didn't realize some of that stuff is on the website, and so they're asking for it, but it actually already exists because you all have already done that work. People just don't know where or how to find it. So maybe more awareness of what exists on the website.
Yeah, I agree, but I struggle with this because we've done a lot of the things in the past, and like we actually have little videos about how to make graphs on our website, and probably no one knows that they're there. We have plenty of web pages about the resources and the methods, and again, no one knows that. So how do we? I mean, do we need to have webinars about unpacking the estimates or accessing resources? Because clearly, producing that stuff and just kind of parking it on a web page is not sufficient. But what is sufficient? I think we have a suggestion. Yeah, is it John?
Yes, John.
Yeah.
I would suggest that once the report comes out, we begin to have regional presentations. It could be webinar.
Mm-hmm.
Maybe for sub-Saharan Africa, for that.
Mm-hmm.
Then people get to ask you direct questions.
Mm-hmm.
How do I find it? This is my struggle.
Mm-hmm.
But in a big conference like this, we don't even have 90% of the people here.
Yeah.
So it's very difficult to know what is in your website.
Yeah. No, I think regional webinars is a good idea, and after a report is a good opportunity. Also, we go through a country consultation before we publish new estimates. So the consultation process is another opportunity to engage with people and say, listen, this is what's coming in the pipeline. This is how it was generated. What is your feedback? Please.
So I basically do the tool in this, ask for a tool. I want just a thing that I can use, that I can download in Excel or Word. But I had to go, it's not easy to find. So
Yep.
and also I get interested in all the other stuff.
Mm-hmm.
I had to go to Washington Schools, and then I was like, oh, maybe it's under methods. No, it's not under methods. And then I was like, oh, resources for data collection and data analysis
Mm.
Like it's in the text, but like I'm looking for tools, I'm looking for
Mm.
practitioners. Like I wonder if it's just a question of we're not good at reading the whole thing.
No, it's buried.
Report.
It's,
So like,
yeah.
and just to say like I put this, but also I get interested in all the other things that you can't.
Hmm.
So I think it's just making it like tools.
Yeah, I think especially around tools, you know, we could make the website more easy to find tools. Yes. Okay.
Low attention span.
Well, no, and I mean, your job is not to like navigate every nook and cranny of the JMP website. It should be easy to find. If it's not easy to find, we need to fix it. Let's see. We've got about 5 minutes left, so I'd like to ask Tanvir to come up and share reflections from his group.
I think most of the recommendations are already discussed. Just maybe 1 or 2 points regarding the viewpoints from the government. I think we discussed quite a bit about how different governments feel about the JMP estimates, and there is, of course, I see as very similar things as with my government in Bangladesh, and the viewpoints from Ethiopia, Tanzania, and also Nepal. I think we have some, I would say, there is trust issues here regarding what is presented in the JMP estimates and what the government is presenting as a nationally representative data. I think much of it stems from the understanding of how JMP estimates are done. Some people, I think most of the people in the government think that this is data which somebody collects and then puts it, and that's where you get, and it contradicts with the national data. And then you say that JMP data is giving low estimates and things like that, but actually it's totally different. It's an estimate. It uses national data to construct your these estimates, and the national data is where you actually have to look for if there are any discrepancies. Now, governments are actually still now, even after 10 years after the definition, they still probably don't know the true meaning of safely managed water and sanitation services. And as even the definition is given, some government inherently doesn't really want to believe that this is safely managed. Some people like to think that if we provide water services, that's enough. Why do we have to look for other things, chemical contamination as such and things like that? So I think there a bit of advocacy can help in understanding the different nuances of the data and how it's presented. I think that when the country consultations are done, if we do more consultations with the health, education, and the WASH ministries, and try to integrate them with the National Bureau of Statistics or whichever organizations collect the data, sit together with all of them and try to understand how this whole thing works, what is collected, what is represented, and what part goes here in the JMP estimates. I think we all agree that academics find this more interesting than the government officials. We researchers, we tend to go there more and try to find comparisons and things like that. I don't think that government officials are very much interested to dig deep into the data, and find that more interesting. One aspect, I think that this is the last point that we'll try to highlight, is that they need to understand that for granular level WASH programming, the JMP data might not be useful. It's more for global comparisons and looking at these quantiles and things that are represented. For granular level WASH program, you have to look at the national representative data. One thing I missed is that when JMP tries to select which one is a nationally representative database, there is always some disagreement between the government and the JMP team. and those are probably not resolved in the end. The government thinks that this is more representative, whereas the JMP team thinks that that is more representative, and there is always a kind of back and forth and disagreements which are not resolved, and the end result is that the government kind of ends up disowning the JMP estimates to some extent. So I think there are many, these things can be worked on a little bit. A little bit of advocacy might help. Thank you.
Wow, I really love those points, Tanvir. And we have had an experience in Bangladesh with government tensions. Please.
Just on the point, which we haven't, discussed in our group. My request to you is, you remember a decade ago you have been in Egypt,
Mm-hmm.
and when we were discussing with KPIs,
Mm-hmm. Yep.
you remember?
Mm-hmm.
So my advice, if important, is that on Monday we have seen the experience of India, you see,
Mm-hmm.
and how Prime Minister Modi is driving
Yes.
and then transforming the wash
Mm-hmm.
across India.
Yep.
And there are billions,
Mm-hmm.
not millions.
Mm-hmm.
And we are very much amazed about the achievement they came up with.
Mm-hmm.
So my advice is, in case if the JMP team could work around the difference
Mm-hmm.
with an exercise of what really India is moving or shifting.
Mm-hmm. Mm-hmm.
Came up with that report and analysis as a showcase.
Mm-hmm.
So other technical ministries, maybe
Yep.
In Ethiopia, for example, the Minister of Health, Education and Water
Mm-hmm.
could have the appetite
Yes.
to do an exercise on data
Mhm.
collection and processing jointly with the National Bureau of Statistics,
Yeah.
so that we can improve really one,
Mhm.
our data reliability,
Mm-hmm.
and two, our transparency and accountability to the donors as well as to the fellow Ethiopian citizens. So
Yes.
in case if this is a very fresh data, and,
Yeah.
and everybody is talking about India,
Yes.
both in water, sanitation, and
Yeah.
hygiene, you see, and if JP could come up with to show the difference.
Yep.
When leadership and political buy-in is already owning the sector,
Mm-hmm.
and that really can make a difference in the change in the sector.
I think one of the tensions is that JMP data are all based on national data sources, but a lot of them are coming from the statistics office. And often the line ministry doesn't agree with what the statistics office says or doesn't consider that to be the best source of data. India is a really interesting case because a big part of Swachh Bharat and Jal Jeevan missions is around data. And they have strong data systems, and the JMP uses national, like sectoral data when it's representative and reliable. And in the case of India, we've had a lot of discussions, detailed discussions. They understand our methods. They know that we're using regression, and we understand their methods, and we are using data from Jal Jeevan and Swachh Bharat in our estimates. And I think that's gone a long way to increasing trust in India. I mean, the other day when the secretary was asked, okay, you have 81% household connections, how many of them are safely managed drinking water? He cited the JMP statistics, and that's 10 years ago, that would not have happened. It happened because of this intense communication. It happened because India has increasingly reliable routine reporting systems, and a lot of lower middle income countries don't yet, but that's the trajectory, that's where we're moving to. So there's always going to be a tension when we look at a national MIS and we say, that's promising, but it's not covering all districts, or it's only the high reporting districts that are contributing. We can't use it yet. But I think that's the way we should do it. The honest limitation I have to shout out to is that we're a team of 5 people, and one of them just lost his job because of cost cuts. So our ability to have these intensive engagements at the country level is really limited. Even the idea of having regional webinars, we love to do that, but we just face resource limitations on the human resources side to do that. Maybe with automation we can do more, but I think we need to do that. And we end up needing to rely on other champions to understand our methods and advocate for us and to be a voice when they're engaging with government. So I'm throwing it all back on you. Go out there and be JMP ambassadors and champions for us, as many of you are already doing. So thank you for that, and let's close on that note. Oh, yeah.